Okay, so the third most common question that I get asked from parents is, why does my child have delayed communication? It's kind of a loaded question. I'm going to try my best to explain some possible scenarios, but I will write a blog that might expand on this a little bit. You can feel free to check that out on my website. One reason that a child might be delayed is because the environment that they're in is not facilitating communication. So, in those circumstances, we work with the family on creating meaningful and natural communication opportunities just within their routine. So, it's embedded within their daily activities, and oftentimes we go into the home to give suggestions out. The second reason that a child could potentially be delayed is because they're having a really hard time processing the language. So a parent might say they repeat everything that I ask them to repeat, but they're not using it independently on their own. And that's usually a good indication that they're not processing what you're asking them to say, because if they don't understand it, they're not going to use it independently. And another possible reason is because although they're processing what you're saying, they're having a really hard time accessing their words. So oftentimes it can be that there is what we call a motor planning problem, where they're having a hard time getting their mouth to go where it needs to go. And sometimes they're just having a word retrieval problem. So those are a couple of reasons why, and really a kid can have a flavor of all three of them, but a speech pathologist can walk you through that. And I'm hoping that this gave you some framework for thinking about potential reasons.